I have a confession. You gotta listen. Hello, everyone, and welcome once again to my channel, Abanalysis. So today we are going to talk about PTSD, which is a psychological disorder. Sometimes it's difficult to differentiate between the psychological and neurological disorders because the neurological disorders, sometimes they show itself in psychological disorder in a form of behavior. It manifests itself in a form of behavior. So sometimes it's difficult to differentiate the two. But let's focus on the topic for today, PTSD, which is post-traumatic stress disorder. And I really like this topic because with this topic, with this condition, it can happen to anyone. It can happen to anyone. And according to the NHS website, it can happen to 1 in every 3 people. So it's like everyone is at risk. So my fellow Africans, you can't pinpoint hands at someone and say this family, they have mental health issues, that family, they have mental health issues. So don't associate with them. Everyone is at risk. The reason why everyone is at risk is no one knows the future. So this condition it happens when people go through extreme stressful events. So things such as rape, abuse, and abuse, we have a lot different forms of abuse. We have sexual abuse, like marital sexual abuse. We have rape. We have assault is a form of abuse. And where I come from, we all know that punishment for children is beating. And in certain, how do you call it, ginger in the genital areas, which is, looking back, it's a very cruel, how do I put it? It's not a tradition, is it? I don't think it's a tradition for people to be inserting ginger in the genital areas of children because they've done something that they've been asked not to. So things like that can cause PTSD. And also not forgetting, the women postpartum, like after you've given birth, some women, when they go through that experience, it also gives them depression. So some women go through PTSD because of that experience. So this experience, it can happen to everyone is at risk. A road accident, sometimes you don't even go through it yourself. Seeing someone go through it can stress you out and you can get PTSD. Road accidents is another one. And like different things that we go through in our normal life, different things that we go through in normal life, no one wants want to experience horrible things, horrible events. But sometimes you just happen to experience that armed robbery. There are some very, very cruel armed robbers that they come to your house, they rape your wife or your partner in front of you. There are so many cruel things that that happens to people. Just recently I heard a story of a man who woke up with his wife. When he woke up, he realized the wife was unrespondent, and eventually he got to know that the wife was dead. And years after, he managed to get married, but because of the experience he had with his first wife, when he's sleeping with his second wife, he every single minute he wake up and check if she's alive. So these are some of the things that people go through. I also have this friend who do not celebrate Christmas. Like Christmas is a trauma to him. So imagine every 25th December, or like getting closer to Christmas. Imagine the trauma that that person will be going through. Imagine the anxiety that comes to that person when it's getting closer to that stage, because Christmas is celebrated worldwide. In Africa, Christmas is celebrated. So imagine, because that person goes through this trauma because his parents had an accident. He had an accident during Christmas time. He survived, but unfortunately for him, he lost both parents. So it's a very difficult thing. It's a very serious thing, and no one knows when such a thing will happen to them. Sometimes you get the traumatic experience right after you've experienced that event, whether it's rape, whether it's assault, whether it's accidents, mugging, robbery. Sometimes you experience the trauma right after the event. Other times, it takes months and years before you start feeling the experience, before you start having the trauma. And some of the symptoms that comes with the trauma is nightmares. You start having flashback because it's like you relive the situation. And another thing that I forgot to mention, another serious thing, is coup d'etat, especially in Africa where I come from. There's a lot of coup d'etat, there's a lot of tribal war. So those also, it's one of the serious things that causes PTSD. So the symptoms that come with it is flashbacks, nightmares, feeling very anxious, difficulty in sleeping, which is insomnia, and you feel distress, and it's not a very good thing. It's not a very good experience at all. But I want you to know that there is help available. Some of the things that triggers this PTSD is terrifying events. Let's say some person has gone through an event, a road accident. So when they see a road accident, then like they relive their situation. So it's very, very sad. When you see someone experiencing assault, then it reminds you. Sometimes when you live in a war area, or you've experienced war or coup d'etat, when you hear a loud noise, a loud thump, like it takes you back to that moment. So it's not a very good thing, but it can be. There is help available. It does not matter how long you've experienced it. Some mothers have gone through postpartum. How do you understand what I mean? After you've given birth, some mothers experience depression, and because of that they don't want to get pregnant again. And other mothers, it takes them a long time to decide to get pregnant again, and others even stop having coitus with their husbands. And some husbands too, when they experience their wives giving birth, it also have this trauma on them. So this PTSD, it can happen to anyone. So my fellow Africans, you can't point at a certain house and say that these people have mental health issues. We all have mental health issues the same way we all have physical health issues. There is help available. There is help available. So please seek help. You can there is psychological therapies available, such as CBT. It's available to handle this PTSD, and there's medication available as well. Seek help, ask questions. Some of the risk factors is when you see someone withdrawing. Some of the risk factors is when people do not have a big social support, when you don't have support, when you don't have a lot of friends. It's you tend to be by yourself and you think a lot, and then you end up getting depressed. So when you see someone showing signs of depression, showing signs of withdrawal, and especially with their teachers, when you are in class, sometimes a child act up at a certain lesson. Let's say literature, you are teaching, let's say Ibadan, splash and scattered and all that. You realize that when you are analyzing that type of poem, the child, your students start acting up. Maybe there is some words in it that brings back some of the traumatic experience they've gone through, like it's scattered. Then it reminds them of scattered dead bodies. It's just so you have to take notes. You have to take note of what triggers that traumatic experience in the person. You don't have to be beating the children. That's not the best way to solve problems. You don't have to be beating the children. That why are you acting up? You are always acting up in this lesson. You're always acting up. If the child is always acting up in that lesson, try to find out why. What words triggers his behavior. So please, there is help available. I seem so withdrawn today. I feel hot. Okay, so there is help available. Please seek help. Talk to people. Don't suffer by yourself. Seek help. There is help available that can solve your issue. Don't suffer alone. Don't suffer by yourself. Don't pinpoint hands at families that they are mental families. Everyone has mental health issues. The same one, everyone has psychological issues. Thank you for listening. Ask questions, comment, subscribe, and let's keep talking. Let's keep creating awareness in Africa, especially West Africa, for mental health issues. We need to heal people. We need to heal our nation. We need to let people, we need to create awareness that mental health issues is the same as physical health issues. Please, please, and please seek help. Thank you.